Today we announced 56,014 cases of COVID-19 in the state and 5,372 deaths. We continue to see reductions in new cases in all regions across the state. However, there is variability in how the disease is spreading regionally. The northern lower peninsula and the upper peninsula continue to see low rates of cases, and the rate of cases remains relatively unchanged. Southeast Michigan has seen reductions in cases for 7 weeks. It is down to about 20 cases per million people per day. Most areas of the state have reached or almost reached this milestone as well. Western Michigan has seen reductions in case rates for the past week, and the local health departments in that area of the state are diligently working to track any new cases and outbreaks. If positive trends continue, we will be able to continue moving forward with the next phases of the My Safe Start plan. I encourage people to go to our new dashboard that was announced this week, www.mystartmap.info, to understand how the disease trend and risk level looks in your area. But I want to caution people, moving forward with reopening the economy does not mean that the risk of the disease has gone away. We still need everyone to do their part with social distancing, wearing a mask, cleaning frequently touched surfaces often, and hand washing. If we do not, this disease still has the ability to spread and to kill many more people, so we cannot let down our guard. As we slowly reopen the economy, we also continue to work to expand testing. We know that testing is critical to our ability to be able to understand how prevalent this disease is across the state. During the last week, the average number of diagnostic tests per day was about 14,400, an increase of 700 tests per day compared to the previous week. We are nearing the state's goal of 15,000 diagnostic tests per day and are looking forward to continued expansion beyond that number. We have seen some key successes in recent weeks, working in close partnership with the Michigan National Guard and our local health departments. The National Guard has tested over 44,000 individuals in the state this month and has distributed an additional 19,000 testing kits to our partners across the state. Testing efforts have included individuals in prison, many of the county jails, and a rapidly expanding number of nursing homes and long-term care facilities and community testing sites. We're taking further steps to expand testing throughout Michigan communities, particularly in underserved urban and rural areas. The governor's executive order, announced on Tuesday, allowed testing without a doctor's order. And the Michigan Department of Health and Human Services has expanded testing eligibility criteria to include a very broad range of people. The overwhelming majority of Michiganders can now get a test. All you have to do is call our hotline at 1-888-535-6136 or visit our website, michigan.gov/coronavirus test, to find a testing site nearest you. We know that testing is just one component of containing this disease. We also have to quickly reach out to individuals who test positive and reach out to their contacts so that anyone who may be infectious is appropriately isolated from others. We are aggressively ramping up this effort called contact tracing. By the end of this week, the state will have trained more than 500 volunteers to conduct contact tracing through our new centralized platform. We also stand ready to hire additional staff to support the efforts of our local health departments. Over the past month, in partnership with local health departments, we have doubled the speed at which we are contacting COVID-19 positive individuals to conduct case investigation interviews. We've also implemented a new centralized contact tracing platform that reaches out to every known contact of a positive case within 24 hours. We're making great strides. But for this very important contact tracing effort to work, we need the help of the general public. If someone calls from the state or local health department, please answer the phone. It is so important that we talk to you. Please know that we are not monitoring your movements. We won't ask you for your social security number. We won't ask you for your credit card. We're simply trying to alert you that you've had close contact with someone with COVID-19. If you test positive for COVID-19, it's also critically important that you tell the health department staff about your personal contacts. Some people have been hesitant to share this information with us, but if you do not do so, we cannot notify other people of the risk, and more people could get seriously ill or even die. And if a health department staff person tells you to self-quarantine, even if you have not tested positive, please take it seriously. We know that people can spread this disease to other people even without having any symptoms. So staying home if you have been exposed is critical to stopping the spread of this virus. I remain thankful that so many of our citizens are adhering to social distancing measures and wearing masks. This has truly made a difference. Testing and contact tracing are making a difference as well, but we need everyone to continue to do their part. Through our combined efforts, I know that we can prevail against COVID-19 in Michigan.